Hello, Brad here from 999 KnowHow. In this video, I'll be going through an initial response to mental health crisis. By the end of this video, you'll know how to identify signs of a mental health crisis, understand common mental health conditions, and have tips on how to provide appropriate initial support. So, let's get started. First, let's define what a mental health crisis is. A mental health crisis occurs when an individual is unable to cope with their mental health symptoms, which can lead to a deterioration in their well-being. This may involve severe anxiety, depression, suicidal ideation, or aggressive behaviours. Recognizing these signs early is vital for effective intervention. Here are some common mental health conditions that you might encounter. Anxiety disorders. These include generalized anxiety disorder, panic disorder, and social anxiety disorder. Symptoms may include excessive worry, restlessness, and physical symptoms like rapid heartbeats. Depression, which is characterized by persistent feelings of sadness, loss of interest, and fatigue. It can lead to suicidal ideation if not addressed. Bipolar disorder. This condition involves extreme mood swings, from manic highs to depressive lows. Individuals may also experience impulsive risk-taking behaviours during manic phases. Schizophrenia, which is a disturbance of a person's mind which affects how they think, feel, and behave. Symptoms may include delusions, audible and visible hallucinations, and disorganized thinking. Post-traumatic stress disorder. This can develop after experiencing traumatic events. Symptoms may include flashback, nightmares, and severe anxiety. Understanding these conditions can help you recognize when someone may be in crisis. So how can you recognize a mental health crisis? Here are some common signs and symptoms to look out for. Changes in behaviour. Sudden changes in mood, withdrawal from social activities, or increased irritability. Emotional distress. Expressing feelings of hopelessness, worthlessness, or overwhelming sadness. Physical signs. Neglecting personal hygiene, changes in sleep patterns, or noticeable weight loss or gain. Risky behaviour, engaging in self-harm or threatening to harm others. If you notice any of these signs, it's crucial to act promptly and sensitively. When responding to mental health crisis, follow these key steps. Ensure safety. First, assess the situation to ensure it's safe for you and the individual involved. If necessary, remove any potential hazards. Approach calmly. Use a calm and reassuring tone when speaking to the person. Introduce yourself and ask if they know why you are there. Listen actively. Give the individual space to express their feelings. Use open-ended questions to encourage them to share what they are experiencing. Show empathy. Validate their feelings and let them know it's okay to feel the way they do. Acknowledge their distress without any judgment. Offer support. Discuss possible options for support, such as contacting specialist mental health professionals or speaking with a mental health crisis phone line. Encourage them to seek help if they're comfortable. Following these steps can make a significant difference in how a crisis is handled. Here are some common terms that you might encounter in mental health scenarios. Crisis intervention. And this is the immediate support provided to someone in a mental health crisis to help stabilize their situation. Psychosis. A condition characterized by disconnection from reality, which can include delusions or hallucinations. Suicidal ideation. and these are thoughts or plans related to self-harm or suicide. Mental health first aid. The initial assistance provided to someone experiencing a mental health crisis before professional help can arrive. Let's consider a scenario that you might encounter. Imagine you are called to a scene where a person is visibly distressed and agitated. As you approach, you notice they're pacing and having difficulty focusing. You ensure the environment is safe, calmly introduce yourself, and ask how they're feeling. By listening actively and showing empathy, you can help de-escalate the situation and guide them towards appropriate support options, such as contacting specialist mental health professionals or speaking with a mental health crisis phone line. Let's quickly recap what we've covered. A mental health crisis is a situation where an individual cannot cope with their symptoms. Common conditions include anxiety disorders, depression, bipolar disorder, schizophrenia, and post-traumatic stress disorder. Key signs include behavioural changes, emotional distress, physical signs, and risk-taking behaviour. Initial responses should focus on safety, calm communication, active listening, empathy, and support. Remember, your response can help individuals feel understood and supported during a crisis. Thanks for watching. If you found this video useful, please give it a thumbs up and subscribe for more insight into first response emergency care.